Hello, everybody. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. Every Monday and Fridays, we are doing Facebook Live, bringing specialists, clinicians, researchers, parents from all over Canada to address the main concerns and questions you might have at this time during the pandemic. And this week in Canada is Father's Day. Father's Day is on Sunday, June the 21st. And the whole week, we're going to put a lot of attention on dads because they usually tell us they are always left behind. And the folks in the NICU is usually moms. So today I have here with us Dr. Andrew Howlett, who is a psychiatrist and assistant professor at the University of Toronto. He's a service head for the Child, Adolescent, and Family Mental Health Program at St. Joseph's Health Center here in Toronto as well. And he is the founder of the Father's Mental Health Program, where he provides clinical care to expectant and new fathers. He has participated and published research in the area of perinatal mental health, including group couples therapy, behavioral activation therapy, and the treatment of perinatal depression of men. Dr. Howlett, thank you so much for joining us here today and welcome to our Facebook Live.
Yeah, no, it's my pleasure. Thank you so much for inviting me to participate in these really important activities that you guys are doing, and nice to be here the week leading up to Father's Day.
Thank you. I will start by asking a very basic question. Why fathers' mental health matter?
Yeah, no, it's a great question. And I think the reality is that parents, men or women, have, the possibility of experiencing a lot of difficulties in the transition to parenthood. And I think as many might know, it's certainly a vulnerable time for women's mental health. And it's also clear that it's a vulnerable time for men's mental health, and that men may be experiencing symptoms of depression or depressive episode, more so in this stage of their life than perhaps any other stage. And so for that, it's obviously, important to draw attention to that and to do what we can to, reduce the mental health suffering of a dad at this time. But also, as you can imagine, the whole family is so important and so connected at this time. And the mental health of one person might affect the mental health of others. And there's also, the reality of, of looking after a new baby and establishing, one's relationship with them. So much is sort of at stake. And I think as a result of that, men I find are motivated at this time to address any health concerns that they might have otherwise ignored or that is occurring at this time. Because this time is so special for them. So it matters because it's suffering that they don't need to experience, but it can have an impact on the family. And men are certainly motivated to want to look after their family, and so addressing that and for themselves makes it an important issue.
Thank you so much. I think this is an amazing conversation that we start to having as a society, really looking at the dads and their well-being as well, not only the mom. I wanted to talk a little bit about your work, because I think you have a very unique work here in Toronto that we hope many other places will follow the lead, and just talk to us about it, your website, what you made available for fathers.
Yeah, so I work as a child and adolescent psychiatrist in Toronto, and then I also provide this father's mental health service, working primarily with men, but also sometimes with couples, and doing some work with women in the postnatal period as well. And yeah, I think I realized doing child and adolescent psychiatry, initially the impact of fathers' positive involvement and engagement with their kids, especially around addressing their kids' mental health. And then I recognized that one barrier for men might be their own mental health issues getting in the way of that. And so we began to explore how can we not just involvement in their kids' care, but engage them and ultimately provide support to them. And it's really evolved, I think, because of other research that's going on in Canada and beyond. A lot of focus around this sort of perinatal period and this transition that men go through in becoming parents. So that's clinically where it's evolved to, seeing men who may be expectant fathers, or new fathers who may be at risk of, or suffering from, mental health issue. the fact that that their partners and then their newborns are receiving care also creates opportunities for men to become aware of this service and perhaps to be nudged in getting a little bit of support or getting kind of checked out to see how they're doing and how they're coping. So we've taken advantage of all these different opportunities of where healthcare system and healthcare providers in the community may be involved in this family sort of beginning with their new baby as ways to identify, screen, assess, and treat men.
So you talk a little bit about the transition from men to be transition into parenthood. Is it different than moms, and how do fathers adapt to that transition?
Yeah, I think, in my experience in working with dads and moms, and as well as the couple, I think that there are perhaps more similarities than differences, in this transition. I think that, mothers going through the pregnancy, maybe get a head start in appreciating how much is going to change. And for some, it can be more of an awakening for men. I also think that it's as much as couples try to prepare. I think nothing can really prepare us for that that firstborn. I think there's things that kind of stand out is just some of the loss that kind of experiences in transitioning to parenthood from your pre-parent self, and how you live your life and how the activities and things that you're kind of involved in, and recognizing having to make some changes there to reprioritize how things are going. I think both men and women fall on a spectrum in terms of their ability to adjust and adapt to that early on, and some require more time for that. Yeah, I think it seems to probably be a bit more of an awakening for men and women generally, but I think the experiences emotionally are quite similar. I think dads are a bit more silent with their experience in this transition. But one thing I've learned is that, often what we hear maybe moms talking about, dads are we can assume, I think, that the dad or their partner might be, experiencing similar stuff. Yeah.
So do you encourage new fathers to do things differently, or what do we encourage them to do at that time, that transition period?
Yeah, I think a lot of it is trying to, for those that we interact with, is getting a sense of their expectations and understanding of their role, and how to kind of expand that where necessary, and for those who are really wanting to be engaged, encouraging them to talk to their partner around how to find opportunities to sort of to have one-on-one time with the baby, to sort of take the lead with certain things, to feel comfortable to practice what they're learning or what they're seeing their partner do or what they're hearing from others, to try in terms of how to soothe the baby and that kind of thing. As much as is requires of us as parents, we try to encourage dads to be able to participate in that as much as possible. One thing we've noticed for sure is that socially, for men in particular, their interactions with their friends and others can sort of drop off, and it may be harder to find time or share similar kind of interests as new parents, and dads may not have those sort of interactions with other dads in the way that moms do in that sort of first 6 months or first year. So, we acknowledge that social isolation and so forth is a real issue for men. And so letting them know that in advance, we try to encourage them to find a few people that they can stay connected with, a few people that they feel comfortable talking with, and we also try to help them find a balance around, their activities, the things that they do to help them stay well and to kind of cope with stress, and recognize for some, it's not easy to continue with all of those things. But look for ways to encourage them to find something that will fit in their family's new schedule. Sometimes I even write a prescription for to continue that jog or some kind of healthy activity, because a lot of times we for whatever reason let go of the activities that usually kept us well, and and allowed us to sort of cope with any kind of stress.
So I have a question for you in terms of the trend that we've been seeing in society, because in Canada now parents can share the parental leave, I guess, and fathers can have the option to stay home with the babies. Is that still a stigma that fathers stay home with the babies? I know a friend of mine who had also a premature baby, and her husband took half of the year to stay with the boy. And he said most of the time when he went to the park, there was always moms. There was not one dad at the park to have that peer support or that connection with other dads. But over the years, have you seen a change in that trend that fathers are more, I guess, present or more hands-on with their babies, and they are trying to find their way and bringing other parents into their circle? Because I feel, I mean, from the time I had my first son 12 years ago till now, there was a little bit of a change, but are we going towards that route?
Yeah, I think we are, but I think the process is slow. I think some areas and regions, even within Canada and outside of Canada, are ahead of us on that. I think Quebec is an area where I think it seems, more acceptable in Canada. I think dads are, definitely, more engaged overall and sort of more hands-on, and I think can appreciate some of the differences, the way that they are functioning as a parent compared to their own fathers. And I think there definitely is some challenges and barriers socially and in the workplace that can interfere with, really embracing the change in policy and the opportunities that are available to dads. And I still hear those stories where dads who are the primary parent, if it's in the first year or beyond, still, not seeing a lot of themselves in the park and in other public spaces, that it's hard to kind of tap into that community, right away. I think what's the other thing I was going to comment there? One thing that I definitely hear from dads, both clinically and others through like Dad Central, is still this desire to hold on to the role of providing for the family, and that being a really important piece of their responsibility, whether or not their partner is also, able to financially provide for the family. And so, they see that, and at the same time also want to have this balance with, being an engaged and kind of nurturing dad, but can struggle because either their workplace doesn't provide them the flexibility or time to do that, or they've taken on a new project, or what I call a baby at work, and are having to kind of struggle this at the same time. So I think they both roles are important, and for some it can be quite stressful trying to find that balance and feel good about both of those roles.
Absolutely. And I think we still have a lot of work to do, and we're learning a lot. And I feel that the dads are finding also their space on social media, with a lot of dads blogging or on Instagram. So slowly, I guess, their voice are coming out, and we just have to learn from the experiences. But last year when I met you, you were talking about fathers experiencing postpartum depression, which really was a surprise to me. I had never heard of that. And a lot of people that I talked to after that, as moms and dads, they also didn't know about it. So how does that look like? Is it the same as mom? But also, how does that affect the family?
Yeah, no, great question. So yeah, up to 10% of men can experience, enough symptoms of depression to be sort of classified as a major depressive episode during the perinatal period, which could be during depression or in that first year of their child's life, with a likely peak around the 6 months after birth. And this is, kind of a rate that's pretty standard, with some fluctuation, in Canada, the US, Australia, and other areas, around the world. There's some talk around like depression in men versus women and what can be different, and is that clearly difference, and at this stage I'd say there's probably more similarities than differences. But emotionally, there may dads may less, may more identify the feeling of irritability and sort of frustration and anger and sense of not being in control of their emotions or those particular feelings. And that may be more common than them describing feeling sad or depressed or being tearful. But then there's problems with concentration, energy, sleep, appetite, and it can affect performance at work and certainly, their performance and support at home with their partner and their child. We tend to see, the behavioral responses. Some people kind of jump and assume that it could be more like outbursts of anger or maybe misuse of alcohol. But often even before that, we notice sort of social isolation and kind of withdrawing and kind of disengaging, from the family or from, work or friends. And that often, that kind of avoidance of stressors is a bit more common before things like outbursts of anger or relying on some kind of unhealthy sort of coping strategy. Although those things, do happen. And it's occasionally there can be like thoughts of like fantasies. I need to escape. I need to kind of get out of this situation. Rarely do they sort of follow through with that, but those sort of kind of thoughts, can also occur. Its impact on the family is significant. I would say that a mother's depression is the biggest risk factor for dads to become depressed. And the opposite is not as strong as it is for the mother's depression initially. But we do know that when dads are depressed, especially if their partner is also struggling with postpartum depression or anxiety, that their symptoms last longer when the dads are also unwell. So addressing and treating the dad can actually hopefully improve the duration in which mom may be also having some of her own struggles. We don't know a lot yet about the true impact of like dual depression, like when both parents are depressed, but it would be a common assumption if the dad is depressed that mom may also be struggling. And then that can have an impact on just sort of on parental behaviors in terms of, how one might talk to the child, or interact, with the child, the time spent, with the child. With the newborn, there's not maybe as much differences as there is maybe when kids are a bit older, where they see some differences in how dads may interact. But certainly, I think one thing that kind of drives dad to, really ask for help is when they get caught off guard by the frustration over not being able to soothe their kid or their baby continuing to cry or not feeding well or these kinds of things. I think they're taken back by how strong of a feeling that evokes in them. And they don't like it and they don't want it. So I think that's, in my view, one of the motivating factors for them to ask for help or them to accept their partner and saying, look, this is happening. Let's see if, we can talk to somebody about this.
So some of it would be expected, but not necessarily the time to look for help. So it is when the emotions are more exacerbated, that's when they should try to get some help around. Is that correct? That's what I understood from.
Yeah, I mean, I think I would say that's been a catalyst for a lot of dads to do that. There certainly could be earlier signs, like, before it kind of gets to that, to that point where it'd be worthwhile to, check in with somebody, or, if they just recognize they weren't, feeling as well, or, their mood, they weren't appreciating, getting happiness out of the same things that kind of typically bring them joy, or you're just a bit more frustrated. Those would obviously be other reasons to look for some help.
Okay, so my question now is around the stigma of mental health and that is going to look for help. Is it still an issue?
Yeah, absolutely. I mean, I think there's still also a stigma with women, and postpartum depression, and for a lot of people, I think the stigma of mental illness can be a barrier, in getting help. And that's why I think it's been important to, try to, separate and kind of establish, our service, and help other support programs for new parents to look at ways of kind of involving and engaging dads in a comfortable way. We haven't compared, it's hard to know, like, how our service has made it possible for some dads to do this. But certainly a lot of the feedback we get is, a lot of gratitude and appreciation for, having something dedicated for dads and for them, and that they hope others can access this.
So, and how is it treatment for dads?
Yeah. So, when a father's sort of struggling, in coping or with mental health symptoms, the first approach is, like at any time in a person's life, is kind of assessing, their mental health and whether there's an underlying mental illness. And then if that's the case, men really like to know what we're thinking, and what we understand their issue might be, and if it is a diagnosis or not. They like that information. They like information on what they can do to try to help themselves. And are often kind of open to help. I would say, the literature says that men are, perhaps more open to, psychotherapy and talking about things as opposed to jumping to medication. And I see that anecdotally, in the clinic as well. And then really all treatment, like, for depression or an anxiety disorder, all treatments are technically kind of available. Men are not breastfeeding or pregnant, so that doesn't cause any limitations around treatment. There are some psychotherapies that have been modified to help women, particularly in this transitional period. So we've been looking at ways to kind of modify that to address specific stressors and issues and the role transition for men. So interpersonal therapy, IPT, behavioral activation therapy, cognitive behavioral therapy, some of these sort of shorter term therapies, looking at how can we modify this so that it really is sort of suits, men at this particular time in their life. And so, looking at that. And then I think, talking about co-parenting, the relationship, it can often be a stressor and require some attention and focus, whether that's done individually or through couple support. That's also another really important issue to address.
So now let's talk about NICU dads, because this is our main population here for the foundation. And we know there's obviously an extra layer of stress being the NICU. Many times unexpectedly, you delivered your baby earlier, or you deliver the baby and the baby requires extra care. Are those fathers at a higher risk of postpartum depression or PTSD?
Yeah, they, there's evidence, some evidence to show some slight increase, and certainly in depressive symptoms, anxiety symptoms, and certainly like acute stress or post-traumatic stress, because there can be, certainly it can be experienced very traumatic, in terms of having a preterm birth or some forth that leads to the child requiring NICU care. And so definitely kind of a higher at-risk group, with that added stress level that really begins, when it becomes complications in pregnancy or at the time of, of delivery. I think dads in general might feel a bit kind of helpless, when as their partner goes through delivery and in that first early stage. And I'm sure that's, even far more significant for dads who are, when their child is in the, in ICU, situation. And that helplessness, I think, really kind of eats away at, what would otherwise be their, hope and kind of innate sense to want to protect their kid and their partner and that kind of thing. And the delay in being able to sort of take over that kind of role, I think can be quite troubling for dads. And I think often, because it's also a very difficult time, it can be for the moms as well, and there's a lot of medical support and other kinds of support. That sometimes dads just don't feel they have the space to sort of talk about their own experience, through that situation. I encourage them to sort of find that opportunity and space, but I recognize that, that it can be really difficult. And like I said before, I think, what a mom might be experiencing, or what as a clinician we understand the mom is experiencing, it's probably safer to assume that the dad or the man is sort of going through similar feelings, as well. I think it's, it can be depending how long the NICU care is required, and how that trajectory goes can often, have an impact, on how the dad's mental health, improves or not over that duration.
And the period of that can happen is also, do you recommend to watch carefully within the first year after the NICU, or because of the stress, that the impact could go a little longer?
Yeah, no, I think I think it's probably dependent on sort of outcomes, in terms of the child's health, and whether there are any ongoing kind of challenges or medical complications or so forth that can if there is issues with that can be a risk factor for prolonged or recurring sort of difficulties in men's mental health. So I think the duration of that really has an impact around that. But typically speaking, for most NICU admissions and discharges, dads sort of fall within that sort of the same time frame of that kind of first year, being the most vulnerable time.
So now with the pandemic, have you noticed an extra increase in dads looking for help at this point? What is the impact that you've seen so far in the mental health for fathers?
Yeah, so I think that the number of referrals and so forth tends to be about the same at this stage. We recognize that people are not, going to perhaps their family doctor's office or interacting with healthcare providers as much because of the pandemic, and as well staying home more in fear of being exposed and that kind of thing. We also recognize that the mental health impact of such a pandemic and so forth will persist longer than other impacts, and the stress, financially, and how this situation, prevents people from getting extra support, and the stress that puts on families, that we reasonably believe that the certainly stress level has gone up, and that we will see some increase in mental health symptoms and conditions over the next while. I would say hopefully that one of the silver linings of this situation is that more new fathers are at home during this time, even if it means working from home. But hopefully for more than that's given them just an increased opportunity to be present, whether they were taking a paternity leave or not, but that they might be available to help out and to see what's going on and to better appreciate what their partner is doing, and how difficult kind of raising a newborn is, and help to modify our expectations and to be more kind and appreciative of one another. But I think too, like being home and confined home all the time and not opportunities to get out, can also increase stress and tension, and so I'm sure there's that outcome as well. But early on, some mothers have reported and dads that it's been nice to have their partner home. But yeah, I think the uncertainties with work and finances and not being able to access support, and obviously this not perhaps being what new parents expected the first year of their child's life to be like, has certainly added some layers to the situation.
Absolutely. But I think the important message here is that there is help available, and it just needs to reach out and make sure that you get the help that you need. So if parents are watching us and want to find out more about your program, how do they find you? And if they are not in Toronto, how can they get help in other provinces in Canada?
Yeah, so myself and my colleague, Dr. Ben Rosen, him and I have sort of created this Father's Mental Health Service here in Toronto. Downtown in the West End is sort of where our offices are located. We do provide virtual care to people in Ontario outside Toronto. We're aware of other people doing kind of research and adding to parent support programs across the country in BC, Alberta, Quebec, in particular, where there may not be a specific father's mental health service, but in those programs that are offering support to parents and maybe initially moms, they are really kind of expanding and looking at ways to, to engage and support and offer counsel to dads as well. So we encourage you to reach out to your, public, services and agencies that are offering help. But if there are concerns, family doctors, nurse practitioners, midwives, people who are involved in this process, I think would be keen to kind of respond to a dad who, who wants to check in around their mental health, or if you're worried you're struggling with symptoms of depression, like at any point in our lives, I think it's worth seeing someone to talk about. And hopefully, this time is a kind of a positive motivator to tackle any issues that might arise. And yeah, we're here happy to help, and it's been a real privilege to work with dads through this process.
Dr. Howlett, but you also, on your website, you have a screening tool that fathers can do at home. Is it like a self-screening tool? Can you give us the link to your website so parents can actually have a look there and see if that's a need for extra help?
Yeah, so the website is www.fathersmentalhealth.com. And there is some information there. We're actually updating the website now. So if you check in on it today, come back in a week or two. We're hoping to add some more information to it. And in that, there's also a couple screening tools. And those are some general screening tools that you could also kind of Google, like if you want to self-assess for depression or anxiety. And those can be really helpful just to kind of self-assess, where a dad or where you might be at, at any given time. And those numbers can correspond to to how serious, the depression, for example, might be. And doing so might be able to help you put some validation and kind of even a number to how you're feeling, and to use that to, kind of communicate to your family doctor, who also may initiate kind of similar screens, in their office. I also want to highlight like the dadcentral.ca website, which is also a great place to for support, or to learn more about different issues, related to fatherhood. And if there are agencies out there who want to, just be more kind of mindful of dads, there's some great tools on that website as well.
That's wonderful. Dr. Howlett, thank you so much for joining us here today, for sharing your expertise, all the work that you do, and for your time, because I know how busy you are. So thank you so much for joining us.
It's my pleasure. Thanks for having me, and feel free to check out the website and reach out.
Thank you. And thank you everyone for watching us here today. I'll be back on Friday. And on Wednesday, Kate Robson, who is a psychotherapist and also mom of 2 preemie girls, hosts a real-time peer support group here on Facebook. And to access the link, you can join the Canadian Preemie Parent Support Network, which is our private Facebook group. And on Friday night, 6 p.m. Eastern Time, Jonathan Foster, who is also a father of 2 preemie girls and a mentor parent at Mount Sinai Hospital and Michael Garron Hospital, will be hosting a real-time peer group for fathers, as fathers can chat, share experiences, or talk about what's happening in the world right now. So you can access also the link through our Canadian Preemie Parent Support Network group. So thank you everyone, and stay well.